Hello, you may have just had or are thinking about having a vasectomy. This video will explain what to expect after you have had a vasectomy and how quickly you can expect to get back to normal. Aching, bruising and swelling of the scrotum is common for a few days after the operation. Take regular paracetamol and ibuprofen for the first couple of days and wear tight-fitting underwear. Rest will also help with the discomfort. Hygiene. You can shower the day after your vasectomy, but avoid baths or swimming for the first 7 to 10 days. Physical exercise. Avoid standing or walking long distances for a few days. Sports should be avoided for 7 to 10 days and resume gently, determined by your level of comfort. Returning to work. Most men are able to return to work after 1 or 2 days. If you have a job that is labour intensive, it may take 5 to 7 days. Having sex. It's advisable to avoid sex for 10 days as it can increase your risk of complications. Only have sex once you are comfortable. A vasectomy does not work immediately, as it can take a few months for the sperm tubes to fully scar over. For this reason, we wait for at least 4 months and 24 ejaculates before we test your sperm. At this 4-month mark, most men are sterile. However, for a few men, sperm are still getting into the ejaculate. This may or may not clear with time. Ultimately, 1 in 100 to 1 in 200 vasectomies fail to work, and we think this is because the body rejoins the cut tube permanently. For this reason, it is essential that you continue to use additional forms of contraception until you have had your sperm test and been given the all clear. Remember that a vasectomy will not protect you from sexually transmitted diseases. Barrier methods, such as condoms, should also be used to reduce the spread of infections. A vasectomy should be viewed as a permanent form of contraception. It is possible to attempt a reversal, but this is not always successful and is not available on the NHS. If you have any questions about having a vasectomy or are experiencing problems after the procedure, please get in touch with your doctor.